Fragile X syndrome is one of those conditions hardly anybody knows about until their child is diagnosed with it. It's a serious genetic condition which causes mental impairment and autism and is actually more common than cystic fibrosis. Health experts say testing for the condition is simple and available, but not routinely done.
Charlotte Lawrence-Slater knew something wasn't right when her son Joshua didn't meet any of his developmental milestones. At 18 months, he was diagnosed with Fragile X syndrome, the leading genetic cause of autism and intellectual disability.
Having the diagnosis is really important because early intervention is the key to unlocking these children and giving them the best future.
More than 100,000 Australians are carriers or have the condition. The faulty Fragile X gene can be passed down silently from generations until an affected child is born. While women can be screened before pregnancy and babies tested when they're born, it's not routinely done.
Every baby in Australia has a newborn screening blood test, and potentially on the newborn screening blood card, each baby in the state could be tested for somewhere between $5 to $10.
John and Christine Kelleher had to convince doctors to have their children tested.
It was only through a friend whose child was at school with ours that we pressed our paediatrician to have the test done, and he finally agreed, and subsequently we discovered that we had 2 children out of our 3 who have Fragile X.
It's suggested that pregnant women who have a family history of developmental disability or severe learning disability should also seek a test. There's no cure for Fragile X, but early intervention and medication can help. Sophie Scott, ABC News.